Hello, my name's Kelley, one of the project workers on the Clinical Placement Expansion Project, which aims to expand placements for allied health professions and nursing students. I'm talking today to one of the lecturers from the University of Exeter about the process of setting up a nursing placement in primary care. Would you please introduce yourself, tell us a little bit about your role and about the Exeter Nursing Academy that you're a part of?
Hi, well, my name's Cathy. I joined Exeter Nursing Academy now about 2 months ago to improve placements within primary care and social care here. Exeter Nursing Academy run a 4-year master's programme. It's a dual registration, adult and mental health programme. The placements, students have placements, 2 placements a year, and it's in their second year they have 3 placements.
Wow. So we've just been talking about a placement that's just recently finished. It was one of the first ones that we helped Exeter University with setting up in primary care. And so I just wanted you to talk a little bit about the process of setting up placements and what support you provide to new placement providers.
Okay, so up to now, what we've been doing is visiting the placement once we've got a lead, either from yourselves or from ourselves here. We either set up a Teams meeting or preferably go out and visit and just have a chat to the practice nurses and the practice leads within there to see what kind of opportunities they could offer the students from Exeter. So that's the first initial step really so it's quite transparent between what our expectations are for the placement and what the placement expects from us too, and to see a familiar face when they come to get a student and have a visit from an academic assessor to the workplace. That's the first thing that happens.
And so if the practice then decides to go ahead and support a student, what is involved then in the process?
Well, the nurses in the practice have to be identified for the specific roles that for the NMC need to be able to support a student nurse. So in particular, those are practice assessors and practice supervisors. And we direct those practice supervisors, practice assessors to an online training resource that was put together in collaboration with the University of Plymouth that the nurses can access, go and have a look at and undertake the short mini e-learning to get them up to speed with the requirements of supporting a student in the workplace. The old mentorship role changed in 2018 to 3 new roles, which is the practice assessor, the practice supervisor, and the academic assessor, who's the link at the university for the placements.
So quite a different sort of more um, team approach to hosting students now.
Yeah, absolutely, and very much student-led as well. So the when we go out and visit, for example, a GP practice, we'll ask the team that works there, because the healthcare assistants, for example, the HCAs, are a very valuable resource for the students to learn from. So we'd like the student to be able to undertake clinics with the HCAs, maybe spend some time on reception. If there's a physio or a paramedic there within the practice as well, the student spending time with them, as well as maybe going out with the GP to do care home visits and home visits. There may be a health and wellbeing clinic, a mental health clinic running that the student could take part in. So it's not about being attached to the supervisor or the assessor for the whole shift. It's very much student led, the experiences they can have, then to bring back to the team approaches you were talking about to support them with their achievements.
Fantastic. So the placement provider is then completed their training and they're happy to go ahead. What's sort of the next step then?
Well, there's an audit process, and when I talk about an audit process, it sounds a scary word, but it's not. It's not audit as you might think a big audit is. It's an audit about checking the certificates, checking the CPD and the training that staff have within the practice anyway, and going through all those um, clinical placement opportunities that the student could have, and making sure that's documented so it informs like a placement plan for the student. So it's quite a productive meeting to go through. It takes probably hour and a half to go through it, but it's a very valuable exercise for both the university and for the placement, so they have full understanding of what that we expect from them. We also have opportunity during that time to introduce the um, electronic practice assessment document, the EPAD that they use, and be able to demonstrate how that is used to sign off proficiencies, to record interviews that the practice assessor has with the student, and how the student can can obtain feedback from HCAs, the OTs, the GPs, all the other staff members, and upload it into a file store for the practice assessor to make decisions on.
Wow. Lovely and high tech these days, isn't it? Rather
Yeah.
than bits of paperwork.
Well, you think it when it was paperwork, there'd be hundreds of pieces of paperwork everywhere, whereas this is quite a simple to navigate electronic system that the practice assessor and the practice assessor has access to. They're invited to join the EPAD by the student, where they can tick the boxes of what proficiencies they've achieved, what professional standards, NMC professional standards they've met, and opportunity to write some feedback on there as well for them.
Fantastic. So once the practice has been, or the placement provider has been set up to and ready to support students, and you've perhaps allocated, what sort of continuing support do you provide in terms of contact and while the students on placement, that sort of thing?
So once we've visited the placement or had a Teams meeting, and we've gone through the practice assessor and practice supervisor training, we've gone through the audit and introduced them to the recording documentation, and everybody's happy to proceed, then we go through an allocation process. And at Exeter, we try and match the student to the placement. So
Mm.
particularly a student who is very keen to work in primary care, maybe once they qualify, then we would look for a primary care full placement for them rather than a spoke 2-week placement, look for a full placement for them. Um, then we would check with the student that was okay, check with the primary care that they were okay with that, send the dates that the placement would be happening, sending contact details to both so the student can contact the practice a couple of weeks before their placement starts to maybe go and visit and see, and to get shift patterns, that kind of thing. We also have a booklet that we ask the primary care provider to complete for us, that we give to the student before their placement, and that gives details on where to park, where to buy a sandwich, can they shower there, have they got a locker, is there a library, a seminar room, is there protected time with a computer there for them to have some protected study time whilst they're there, who names of all the staff, for example, and contact details. So we make sure the student has all of that before they arrive. And I ask the placement to fill that out in as much detail as they can for me, so I've got a chance to see the student before they go. Once the student has been is in place, then there'll be a visit from academic assessor or from myself to check that the student's okay, just to see how the placement is going. But the support for the student and for the placement provider through the whole process. We're very mindful that, for example, primary care and social care don't have a practice facilitation team like the hospital would have. So I provide that support, that resource here at the university.
So after the students finish their first placement with you, with the practice provider, how often would you contact them about further placements then?
So it's really, really important that when we set up a placement that they're utilised throughout the year by a university, because it keeps skills nice and fresh for them. So we share placements where with consent with Plymouth and the University of West of England at the moment, so that we can ensure that placements are utilised. So after placement has completed, we review the placement. We always give a call to check how it went, if they're okay, as well as talking to the student as well. We're doing a bit of a project at the moment because we've got about 5 or 6 first placements into primary care this spring. So we want to collate that information afterwards to check that our processes and systems meet everybody's needs, and that as much as we can get out of the placement as possible for the student. We've explored all those areas, if you like, for the different practices. Um, and then we let the practice know when the next allocations will be, and then hopefully when we'll be able to allocate to them once we go through that process. So allocations are normally 2 months before the placement starts.
Fantastic. And you have 3 placement blocks over the course of the year?
So year one have 2, year 2 have 3, year 3 have 2, and year 4 have 2. The difference with year 4 is if the student is doing the adult and mental health dual registration, then they have those 2 placements in year 4. If they've decided after year 2 just to go the adult route, a master's adult nursing program, their last placement in year 4 is an internship. So that's where they go, and they're much more autonomous in their clinical immersion. They sort that out themselves, preferably, and that's where we would be looking for people who want to work in primary care once they graduate, hopefully going securing an internship where they may well be employed afterwards. So that's
Fantastic.
quite exciting. Yeah.
Yes, yeah. So, do you have any particular advice for primary care practices, or even social care settings considering hosting students?
I think if you're considering hosting students, talk to people that have hosted them. I
Mm,
think that's really key. That's probably what I've learnt through the last few years, really, that I've worked in placements with placements. Talk to people that have already hosted students, because it's easier than you think. Um, Often placements will say they wish they had started earlier. It's brought a lot of value to their organisation, to their workforce, both ways as well. Students learn and the workplace learn. But that's one of the biggest pieces of advice I could have. Go and talk to people that have had these really positive experiences about having a student, and it's not as onerous as you think it's going to be.
mm.
It's student led, it's electronic, which does make things easier. The recording documentation, there's a lot of support out there for you to make it a very positive experience.
And my final question, which is not one that I prepared for you, sorry, Kathy,
That's okay.
but I'll ask what the benefits are for the students. Do you want a couple of
Okay, yeah,
minutes to think
yeah.
about it?
No, that's okay. Okay.
Um, so Kathy, I also wanted to find out what, from a university's point of view, you feel are the benefits for students undertaking non hospital based placements in primary care or social care.
I think one of the biggest pictures is it gives the students a much wider holistic picture of health and care. I think in the past, rightly or wrongly, with just hospital placements, there's been a very narrow view of what a nurse's role is. And nurses going out into these maybe non-traditional settings is actually demonstrating, and they're coming back with this kind of feedback. They're actually demonstrating how they didn't realise the extent of the nurse's role outside of a hospital setting. And they've been overwhelmed, flabbergasted by what they found, and how busy and how acute primary care and social care can be. And I think that's probably the one of the biggest benefits to students for our nurses of the future, to have that experience with the integrated care systems now on board, and the collaboration between health and social care all coming underneath one big banner. It's really, really important that nurses have an understanding of every setting, and that they're able to go and work in these settings after they qualify. So one of our visions are that our students do have all have primary care and social care experiences at some point during their 4 years.
Fantastic. And then that gives them this holistic picture of the patient's journey through all sorts of different settings, doesn't it?
Absolutely, because uh, you have in a hospital setting, for example, and this is feedback that I've had from a student, it's very focused on what the problem and the need is of the
Mm,
student. Whereas maybe in primary care and in social care, they also see the family history in a lot more detail. The social, the economic, the psychological, they see a way bigger holistic picture of the person that they're looking after. And of course, within social care, it's that whole person-centered picture that they're getting, whereas perhaps it's not so focused in a hospital setting because they're only meeting that one person for a short stay, perhaps.
mm. And obviously, when you're in a residential home, it's their home, isn't it? So you get to see much more how they are in their home environment, don't you?
Absolutely. You're going to work in someone else's home
Mm,
in a social care setting, and it's a different focus. It's a different focus completely, because you're sitting down having your lunch with your resident or your patient, if you like,
yeah.
depending on what context you're looking at. So, and to have the students experience that is providing such a lot of information and skill and background knowledge for them. So when they do go and work in hospital, they know, for example, if a patient is being discharged into social care, they've been there on the other side of that discharge, so they know what it's like and what's going to happen. So
Mm,
the expectation is there. So we're hoping that it joins up that little bit of a a barrier perhaps
mm,
between the two areas, when the
yeah,
students have had a better picture of what happens on the other side.
absolutely. Lovely. Well, thank you for talking to us. Is there anything else you wanted to add to this interview?
No, I don't think so. Just to potential providers, don't be worried about ringing the universities up. You can make that step yourself and just ring up and say, I'd like to talk to someone about hosting students. That's absolutely fine. And don't forget the information on that last question on your PIR, the provider information return for CQC, to put that you're an approved placement provider, because that does go a long way as well. It shows you're very open to reflective practice.
Fantastic. That's a good tip.
Okay, thank you.
Thanks so much.